السلام عليكم ورحمة الله وبركاته. نبدأ محاضرتنا إن شاء الله في Inorganic Pharmaceutical Chemistry بعنوان Topical Agents. Simple definition of the topical agents as use of pharmaceuticals or compound on body surfaces and different from systemic. The compound are absorbed into the systemic circulation and distributed to the various body organs. The action of the topical agent is supposed to be limited to the site and surfaces of application, but in some cases it penetrates of topical agent into the deeper tissue or absorption into general circulation, which have beneficial effects such as penetration of antiseptic into the tissue below the skin, prevent the possibility of deeper infection, and this advantage of this penetration is the allergic reaction of the mercury salt when applied topically. The topical application of the drugs may be accomplished within body cavities that open to the outside as a route of systemic administration, such as the suppositories, vaginal and buccal tablets. The compound used typically will be divided into two main broad categories based on their usual action or uses, including the protective agent and anti-fungal agents. The protective agent are substances which may be applied to the skin to protect certain area from irritation, usually of the mechanical origin. The compound used as a protective agent should have the following properties, including the insolubility, unreactive, and adsorbent features. For the insolubility, is preferred that features that limit the absorption of the compound through the skin and makes it difficult to wash it off. For the unreactive, are necessary in order to prevent the interaction between the protective substances and the tissue. And the final features is the adsorbent, which can absorb moisture from the surface of the skin, and removing moisture tend to lessen mechanical friction. Protective action increase activity with decrease in particle size because the small size of particles offer us the large surface area and allow particles to adhere to each other and adhere better to the surface of the skin. Also absorb moisture more efficiently and offer a smooth substance which is soothing to apply and aid preventing irritation. Protective are applied as a dusting powder, suspension containing the insoluble protective substance or ointment. The usual form applied to skin which are subjected to the constant irritation due to the moisture and or friction. The protective should not be used if the area is abraded and exudating fluid, because it will absorb exudate and form a crust which will adhere to the open tissue and also may enhance systemic absorption. The first example of a protective agent is Al-tack, is the hydrated magnesium silicate, and is fine white or to grayish crystalline powder, and it has a smooth greasy feeling to touch. The uses as a lubricating protective dusting powder, and also in a preparation which performed or used for cosmetic purposes, and with antimicrobial agents such as boric acid, when used on broken skeleton, can produce sterile abscesses or granulomas. The second compound is the insoluble zinc, starting with the zinc oxide. It's very fine odorless white or yellowish white powder. The uses as a astringent and antimicrobial compound due to the release of the small amount of zinc ion from hydrolysis and acidic moisture on the skin. Also, it's protective in ointments, zinc oxide ointment, and as a dusting powder in combination with the antimicrobial agents, example boric acid. The calamine fine powder, pink in color due to the presence of the ferric oxide. The uses of the calamine as a protective in dusting powder, ointment, and lotion, because contain equal quantity of calamine and zinc oxide suspended in a solution of the calcium hydroxide. The local anesthetic and antipruritic action with the lotion containing 1% of liquefied phenol. The titanium dioxide is a white, tasteless, odorless powder, and its uses as protective and also as in sunscreen cream and sunscreen products due to its high refractive index, making the compound useful for screening out the UV radiation, and as a white pigment in cosmetic and paint. The fourth is the aluminium paste containing aluminium at 10% with a zinc oxide ointment, and is used for protective to prevent irritation around the intestinal vacuola and also around the colostomy opening after the surgery in the case of the intestinal cancer, and to protect the skin from the digestive action of intestinal fluid. The antimicrobial topical agent, starting with the antiseptics, is any agent which either kills or inhibits the growth of microorganisms. And as we all know, the side ending of the word means the kill, and the static meaning the standing still stop the growth, such as bacteriostatic and fungistatic. The disinfectant agent used to kill or inhibit the growth of equipment such as the instrument, equipment or rooms, etc. And sterilization meaning the use of chemical disinfectant or mechanical process heat to render an object completely free of microorganisms. And stringent is the application of a diluted solution of a metal cation to tissue, and that effect can be generally described as a shrinkage or firming of the tissue. The example for that is a stringent will cause the constriction of capillary and small blood vessel, hence they are used to stop bleeding from small cut, and also used to reduce the volume of exudate from wounds and skin eruption. The mechanism of action of antimicrobial or inorganic antimicrobial agent can be divided into mainly three general categories, including oxidation, halogenation, and protein precipitation. This represents the primary chemical interaction with the microbial protein, which results in microbial death or inhibition of the growth. So this is the main mechanism action of these three categories. The oxidation, those compounds are generally non-metal and certain type of an ion. The effective reducing action involves the reducing group that found in the most protein, example the sulfhydryl group, such as in cysteine. As we see in the following shape is the sulfhydryl group of protein in the normal protein structure of microorganism. And this is the formation of the disulfide bond in the protein will alter the conformation of the protein of the microorganism and alter its function. The overall destruction of function in the specific protein is responsible for destruction of the microorganism. Hydrogen peroxide is another oxidative antimicrobial agent, and it's mild oxidizing antiseptic. The action is produced when the solution comes in contact with open or abraded tissue, and this is exposing the chemical to the enzyme called catalase, as we see in the equation. And this catalase decompose the H2O to water and oxygen. So the released water act as the oxidizing agent in bacteria and providing the antiseptic activity on the organism to survive through the anaerobic metabolism. This of the hydrogen peroxide, including mild oxidizing antiseptic and diluted solution as a mild antiseptic for cleaning on a wound, when diluted with 1 part water used as a gargle or mouthwash, and half citrine solution as a vaginal douche, and the bleaching color hair and laundry for gloves. The potassium permanganate is a strong oxidizing agent both in solution and in the dry state. The dark purple crystalline compound stored in a well-closed container. The uses as oxidizing agent for skin in different concentration, 1 to 500 and 1 to 15,000. Potassium permanganate solution for the dermatitis caused by the bacterial infection and fungi, and also used in swimming pool for athletics food, and have antibacterial and antifungal. The iodine is a dark violet insoluble in water, and its complex is soluble in water as iodine solution, and its soluble alcohol as iodine tincture, and its action as antimicrobial involve oxidation and or iodination of the microbial protein. The uses as antiseptic on the skin prior to surgery, disinfectant, chemical reagent, and analytical chemistry. The iodine solution is preferred for application to wound because the alcohol in tincture is very irritating to open tissue, and also this preparation are contraindicated in patients who have previous allergy or hypersensitivity to iodine. The PVP is a stable chemical complex of polyphenol pyrrolidine with iodide, and is a broad spectrum antiseptic for wounds and used as disinfectant. And lack of tissue irritation make it is very useful for application to sensitive area and mucous membrane. The second mechanism of action is the halogenation, and this occurs in antiseptic of hypochlorite form. This reaction is destructive to the function of a specific protein because it will cause change in conformation of a protein, and this is the general mechanism of all our agents. The hypochlorite used as a disinfectant and laundry bleach, and diluted sodium hypochlorite solution is made from bleach that have been diluted and treated to decrease the irritation. The active ingredient is chloride that kills most forms of bacteria and viruses. The third mechanism of action is the protein precipitation, and this involves the interaction of protein with a metallic ion with a strong electrostatic field, and aluminum is also an effective protein precipitation. This reaction is a complexation in which the various polar group on the protein and the complexation results in change in the properties of protein or protein precipitation. The interaction of a metal with protein is not specific, and at sufficient concentration will react with the host as well as the microbial protein. Silver nitrate with a different percentage, the 10% is solution is used in the treatment of infected ulcer in the mouth, and 1% used for installation in eye of newborn baby, and 0.5% aqueous solution as a wet dressing on burned area of patient suffering from the third degree burn. The final compound is the sulfur, and sulfur compound has been therapeutically used both internally and externally, and the primary use for product containing element sulfur as the antiparasite and antimicrobial agent, and uses in the seborrhea and for acne and psoriasis. Thank you for your listening.